This is Greg Corombos of Radio America reporting for WorldNet Daily. My guest at this time is Georgia Republican Congressman John Linder. One of the things I know you believe in is a very different approach to health care reform, and Republicans are issuing an alternative package to what the Democrats are putting forth. Your version is considerably shorter. It's a little over 200 pages, and it focuses on several key priorities rather than overhauling the entire system. We should let our listeners know that you are one of several Republican members with a medical background. You're a dentist by training. What did you see as absolutely essential in putting together a reform package in terms of what needs to be in and what needs to be out?
What needs to be out is individual and business mandates. What needs to be out is a Soviet-style system, which the Democrat program is. We have 100,000 applications for an iPhone. People can make all kinds of choices in their life. They can run their entire life off their iPhone, and we're going to build a Soviet-style system to run their health care, give them no choices. The Republican side says there are a lot of things we know we can fix without creating havoc and throwing out the health insurance for the 85% of America that likes what they have. We ought to fix the junk lawsuits. We spend $200 billion a year on defensive medicine because they're afraid of being sued. That's $2 trillion over 10 years. That's enough to pay for all of their programs, but they don't do that because their single biggest base of support is trial lawyers, and they protect them. We should be able to buy insurance across state lines. If you buy insurance in New York City, you have 52 political mandates that the insurance company has to cover you. So you're paying for hair transplants. I don't want any. But you have to pay for it because they're mandated. If you let them buy across state lines, the 1,700 health insurers in this country will be gracious plenty competition. We should also fund the risk pools so that we can help pay for regular insurance for those who have pre-existing conditions, and our proposal does that.
Congressman, what do you expect to happen here? You mentioned you might actually get sent home and have this issue come up in a few days. Do you think there will be something passed by the end of the year?
In 1993, the Clinton administration came up with their big budget tax increase. If you recall, it passed by one vote.
Right.
And in it was a BTU tax. That there was going to be a tax on energy with respect to how many British thermal units it produced. Everybody hated it, but they voted it in, and the Senate dropped it. And those folks who got BTU'd lost their seats in the House. Those 82 people in those swing districts desperately do not want to have to vote on a health care bill, which is a takeover of the health care system, and then have the Senate not do it. So there's going to be increasing resistance against the leadership in the House to have a vote this week and even this year. They would love to have the Senate take the lead.
Congressman, we'll certainly keep a close eye on this and see what exactly develops in the coming days. Thank you, sir, very much for your time.
Thank you, Greg.
Georgia Congressman John Linder represents his state's 7th Congressional District. I'm Greg Corombos of Radio America reporting for WorldNet Daily.